Hi everyone, she in here. That's what she said. Coming to you live today on December 31st, 2019. First, I'd just like to wish you all a happy new year. Happy, prosperous, abundant, healthy new year. And secondly, I just wanted to come to you with an update on myself because I've had a recent setback. It seems like with this breast cancer diagnosis, there comes along with it bumps in the road. And that's just the mentality and way I'm trying to look at everything so that I can get through it. Thankfully, I have so much support from my father, my mother, my stepfather, my best friends. Everybody's been really pouring out to help me. I've wound up being admitted to the hospital 3 times in the past 2 weeks with radiation pneumonitis, which at first they thought I just had regular pneumonia, but now they've done a CAT scan and determined that it is radiation pneumonitis from the radiation treatment that I got to my right breast. And so last week I was admitted into Cooper in Camden, and I was put on an antibiotic called Bactrim. And what happened was, over the past week of me taking that, I wound up being allergic to it. And I got really, 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 really sick on Sunday. Actually, it started on Friday. And then Saturday it got worse, and I had my neighbor Kate and Jordan, another 2 God-sent angels. They noticed that I didn't let my dog out all day, so they just let themselves in my house to check on me. Kate has a key because of how much she helped me all the time since I've been neighbors with her. She helps me with Zaza and with Ziggy and anything, really. She's just such a generous person. So she came barging into my house on Friday to make sure, on Saturday, to make sure I was okay, and I really wasn't doing well. She helped me force feed some food down, but I was really, really delirious and lethargic, out of it, not really sure what was going on, but I kept just sweating and sort of thrashing around, and I kind of pushed her away, saying, I'm gonna be okay, I'll be okay. I ate, she helped force feed me some soup and got some ginger ale down, and then I called my best friend Rachel the next day and asked her to come and take my vitals. And my blood pressure was so low. It was, I think, 84 when I was laying down and 80 when I was sitting up. And then when I stood up, it dropped to 70. So she was really scared. And honestly, she is one of the toughest cookies I know. She's a nurse practitioner in critical care and nurse for a long time. And I've never seen her scared before. And she was scared as heck on Sunday when she came. So she wound up calling my dad, and my grandmother came over, and they just made the decision that we got to go take her to the hospital. So I felt so sick. At this point, I actually was vomiting at least 3 or 4 times throughout the night and day. So I was vomiting, lethargic, thrashing around, scaring the crap out of my grandmother and my dad and my neighbors. And when they got me to the emergency room here at Shore Memorial, they just started taking immediate great care of me. And They wound up doing a CAT scan to assess the radiation pneumonitis and really delineate that to make sure there were no pockets of fluid or infection around my expanders. And thankfully, they look good. So there's one other thing that is misfortunate, but happened last week, that I had an incident with my plastic surgeon over expanding my chest. And so, just to put it mildly, she's no longer my plastic surgeon. I now have a new plastic surgeon, which makes me very nervous because I've had established a good relationship with my doctor over the past year. And to have a new surgeon at this point who actually has a different plan is really scary. He wants to put the implants in over the muscle rather than under the muscle. So we're talking about a whole new surgical strategy now too. But I'm glad that I did not let Dr. Fahey do emergency surgery on me last week to take the expander out because it was not infected. It's the radiation pneumonitis that's been causing this. And then they gave me an antibiotic, which I wound up being allergic to, called Bactrim. And that is what threw me for a loop and sent me into the hospital for this admission. You know, I still have the same philosophy. Everything is happening for me and not to me. And just learning how to mother myself, just the basics. Drink enough fluids, eat 3 meals a day. It's really challenging when you have cancer and you're on all these different medications and you're not feeling well. But it is my primary goal for 2020. And this has given me a lot of time to reflect, like, what I need to be doing and changing for 2020. And so the little list that I have written yesterday is, for 2020, I want health. I want full surrender. No more control. I can't control anything. I want to have fun and live in joy. I'm going to drink more water and eat more fruit. I'm going to do a better job at mothering myself, not pushing my body too far. Start getting my exercise back in so I can get strong for this last surgery. And get sun and swim, two of my biggest loves, back into my life. Yeah, I just wanted to come and show, again, the reality of this, that, everything's not just over once you're done chemo and over once you're done radiation. The hormone therapy has been very challenging for me, getting the Lupron shots every month. And now I just started another oral chemotherapy medicine called letrozole, which also causes a huge list of symptoms. So I'm dealing with just compounded issues here. And I just need to be patient with myself, with my progress, with my health, and just keep on pushing through and know that I'm here for a reason. I want to thank my friend Natalie for coming by and bringing me lunch today. My friends Chrissy, Jenny, for just constantly reaching out. My family, I love you all so much. And again, I just want to wish you all a very happy new year and an abundant, prosperous, wonderful 2020 filled with everything that our hearts desire. I hope I talk to you soon from a much better and higher place. And I'm sure, because I'm on my way there already. I love you, and can't bend my arm too well with this thing on it, but mwah, I'll talk to you soon. That's what she said.